456, check my check one.
Welcome, everyone, and thank you, excuse me, for coming. We are so pleased to be here to herald the release of this report, which many of us in the gun violence prevention community, and I can say as the co-president of Brady, have worked very hard on with Senators Murray and Markey and others for over 2 years. Today in the United States, 1.7 million children live in homes with unlocked, loaded guns, and 7 children die a day of gunshot wounds due to easy access to guns. At Brady, we have an ask campaign based on a simple premise, which is that parents should ask whether there are unlocked, loaded guns in homes before they send their children on play dates. And so for us, with the release of this report, it represents a tremendous confirmation of what we already know, simply introducing the concept that asking if there are guns in the home works to normalize the discussion about safe storage. This is important to saving lives. The report also notes, very importantly, the lack of federal funding into gun violence prevention by CDC and other federal agencies. We know that there is a dire need for more research and funding on this public health epidemic, with 33,000 people dying a year of gun violence. There is clearly much more important research to be done, and the time to do it is now. So there is much work ahead, and I want to truly thank Senators Murray and Markey for their efforts to request and shepherd this very important GAO report to publication, and in championing legislation to treat gun violence as the very real public health epidemic that it is. I'm very honored to introduce Senator Patty Murray. In her many leadership roles, she has championed this issue, whether on the Appropriations Committee, the Authorizations Committees, in the Democratic Leadership Caucus, and on the Senate Help Committee. When she requested this report back in December 2015, that was just the start. She helped push and shepherd it through, and we thank her very much. Senator Murray?
Well, Kris, thank you, and thank you for everything you and the Brady Campaign do to keep up the fight against gun violence. I am really grateful to everyone who's joined us today, especially Senator Markey, for his leadership on this issue. Today in the United States of America, injuries from guns are among the top 5 causes of death for people under 65. They are the 3rd leading cause of death among children. And regardless of age, people in the United States are more likely to die as a result of gun violence than they are from car accidents, fires, or natural disasters combined. So this is a public health epidemic. It's tragic, and even more so because there is a lot more we can and absolutely should be doing to stop it. One simple but critical step towards this goal is to gain a better understanding of how to encourage safe storage of guns in homes. Right now, 1 out of every 4 households, guns is stored loaded, and half of those aren't kept locked, putting people in homes across the country, and especially curious children and those at the risk of suicide, at great risk. Changing this and encouraging safe storage could save countless lives. But unfortunately, as this report we're discussing today makes very clear, compared to other leading causes of death and injury, there is much more we need to learn about gun violence, including how to better promote safe storage. And somebody just leaned against a button.
We were having trouble with the system earlier.
Okay, no problem. As I was saying, compared to other leading causes of death and injury, it is so important that we learn about gun violence, including how to better promote safe storage. This is one of the leading causes of death in our country, but it's one of the ones we have researched the least. And frankly, like so much about this debate in our country, this makes no sense. It has got to change. Now, we know that some national and local programs have led to safer gun storage at home. I'm very proud that one of those programs in King County in my home state, it's called Lock It Up Campaign, is doing a great job but we can't stop with one county. We need to know what else works, how to scale it, and it shouldn't be controversial. So I'm very hopeful that every senator will take a close look at these findings in this nonpartisan report and join us in pushing for stronger investments in gun violence research. It's a small step, but every step that saves a life is worth it, and there is no reason to wait. So I am delighted to be here as part of this today, and I'm very proud to introduce my colleague in this long, hard slog. Senator Markey is here with me to help promote it.
Thank you, Senator Murray. Thank you for your great leadership on so many issues across the board, including the work you're doing with Senator Lamar Alexander right now. Thank you, whoever hit that button, for showing how unsecured projector screens can be dangerous, and that you need policy to make sure that there is in place a safety check. So it's a small example of how a lack of thought can cause accidents. Thank you to Kris Brown and the Brady Campaign to Prevent Gun Violence for your tireless activism and leadership on gun violence prevention. And thank you to some of our nation's top safety advocates who are here, Injury-Free Coalition for Kids, the American Public Health Association, the National Parent Teachers Association. So let us be loud, let us be clear. The gun violence that is plaguing our nation is a public health crisis. More than 33,000 people are dying in this country each year from gun violence. That is wrong, that is unacceptable, it is immoral. As we read this new report by the Government Accountability Office on safe gun storage programs and research on their effectiveness, we have to ask ourselves, why is this epidemic of gun violence happening, and what can we do to stop it? When disease and illness bring widespread death, doctors and scientists and public health researchers study the causes so that they can find solutions. And the federal government invests in those efforts. For diabetes, which kills 76,000 people in the United States each year, the Centers for Disease Control receives $170 million. For flu and pneumonia planning and preparedness, which leads to 57,000 deaths each year, the CDC's budget is more than $187 million. For asthma, which kills 3,600 people a year, the CDC's budget is more than $29 million. But for gun violence, which kills more than 33,000 Americans a year, the CDC's budget is $0. That is right, $0. And that's because for nearly 20 years, from 1996 through 2013, there was a statutory ban on advocating or promoting gun control, which was widely construed as a ban on federal research into gun violence. But President Obama lifted the ban, and before his death earlier this year, the principal congressional author of that ban, Representative Jay Dickey from Arkansas, disavowed it, recognizing it was a mistake and calling for gun violence prevention research to move forward. So there is no reason now not to fully fund this critical research area, and it's why I've introduced legislation year after year with Representative Carolyn Maloney that would fund the Centers for Disease Control and Prevention to study the causes and prevention of gun violence. The bill authorizes $10 million a year for the next 6 years. This is the type of gun violence prevention that everyone, regardless of political party or affiliation, should support. And it's why the American Medical Association supports ending the ban. The American Public Health Association supports ending the ban. More than 141 groups want to end this ban on researching the link between guns and violence in our society. No one should be afraid of science. No one should fear nonpartisan scientific research, not Democrats, not Republicans, not the NRA. So imagine if we had our best minds studying the reasons for so much gun violence, looking into questions like whether guns can be made safer. For example, these guns that are in drawers of homes all across the country. What if we had a technology that had only the thumbprint of the owner of the gun that could make it possible to use that gun? So the parent could use the gun, but a child could not use the gun because it would not be the same thumbprint. Could we begin to move in that direction, not banning the gun, but making it more safe for other family members other than the actual owner? Could we move in that direction? We try to do that with smartphones, where your thumb can be the mechanism. Can we do the same thing with a gun? We need research. We need work to be done on that issue. How best can we keep the guns out of the hands of young people? How can we strengthen efforts to ensure safe gun storage? What are the best ways to prevent suicides, which represent almost 2/3 of all gun fatalities? It is time for us to take our heads out of the sand on gun violence. It is time for us to confront it with information and open eyes. It is time for us to understand it. If we want this wave of gun violence to end, we need better information about what is causing it and what can be done to prevent it. So let's give the medical, scientific, and public health community the resources they need. Let us study this scourge. Let us understand what is causing it, and then let us put an end to it. My wife was the chief of behavioral medicine at the National Institutes of Health, and what we know about suicide, for example, is that first you have to have the precondition, but then you must have access to the instrumentality of death, coupled then with a precipitating incident in the life of that person. But at that point where we can deal with the access to the instrumentality of death, that's where we're talking about prevention. We're talking about reducing the access, making sure that these guns are not in the draw. That is critical for us to have the discussion across our country, and that's why we're so proud to have all these public health advocates with us, and the great Patty Murray on the Health Committee. So thank you all so much for being here.
Thank you so much, Senator Markey, for your leadership on this issue. And obviously, we at Brady don't stand alone in pushing forward our ASK program, which is really based on a very simple notion, which is parents ask questions every day about risks to their children. Whether I have a daughter who has a peanut allergy, so I always ask before she goes to a friend's for a play date, are there peanuts in the home, or are there peanuts in the food that can be ingested? Our ASK program is based on that same simple premise, the importance of asking whether or not there's a loaded, unlocked gun in the home. And we know the criticality of that question, as I said before, because 1.7 million children live in homes with unlocked guns and loaded guns. And part of the partnership that we've undertaken is with many of the organizations you see behind you, as well as the American Academy of Pediatrics. The National PTA in particular has been a critically important partner with us, and I'd like to introduce next Jim Accomando, who is the head of the PTA here in Washington. Thank you.
Thank you, Kris, Senator Murray, Senator Markey, for the opportunity to participate in this discussion on a very important release of the GAO. PTA has a strong history of supporting and advocating for laws and regulations in the areas of gun safety and violence prevention. It has been and remains a top priority of National PTA and PTAs nationwide to prevent and eliminate violence in schools, communities, and at home, and promote safety for children and youth. Every child deserves to learn and grow in an environment that is safe. Sadly, the threat of gun violence for children has increased, and our country has experienced far too many gun-related tragedies. Unfortunately, I have seen firsthand the horrendous impact of gun violence on children and families. I was president of the Connecticut PTSA when the shooting occurred at Sandy Hook Elementary School in Newtown, Connecticut. We banded together just 2 days later after the shooting to meet with the PTA and came back with 2 initiatives, one for healing, which established snowflakes for Sandy Hook to decorate the school in a warm environment when the children returned, And the other one was to fundraise. We raised $1.1 million to travel with those children affected from mental health. Unfortunately, too, at home, my wife's father, a victim of suicide, my nephew, a victim of suicide. In the case of my nephew, we were vacationing. He was of age to stay at home, so no one thought anything of it. My brother-in-law, I have no guns in our house, but my brother-in-law not only had a gun safe, but his handgun was locked within a box within the safe, so we thought everything was fine. Needless to say, towards the end of our vacation, we got a call from the police in Havasu. They live in California. This was 2 states away, saying that they found his body alongside of the river that he used to camp with his family. He committed suicide with the very gun. Had it not been for that fisherman stopping, we would have had no place, as there was no clue, no indices, no place to look. So we were thankful for that. My father was a police officer for 32 years, to the point that Senator Markey had mentioned. He'd come home from work and just leave his handgun in his top drawer of the dresser. I grew up in the 50s and 60s with my 2 older brothers. But we knew you do not go into the room, you do not open that drawer, you do not touch that weapon. Something changed, but that was all we needed for a safe back then, and I know it's different now. School safety starts at home. When families store their guns responsibly, they're much less likely to end up in school. It is critical that guns are kept safely away from kids, and that we, as parents, ask if there are guns in the homes where our children play. My kids are 22 and 17. I've been asking since day one. And it really shocked me, but it coincides with the statistics, how many families do have guns in their home. It actually was very, very frightening as a new parent. Along with safe storage, it is essential that research is conducted on the causes and effects of gun violence. In order to fully understand this epidemic that our nation is gripped with, we need to first understand the causal relationships and the effect such violence has on our communities. Only by building upon research-based initiatives can we begin to address the root American gun violence and pathways to decreasing that violence. During our 2017 convention in Las Vegas, National PTA delegates adopted an amendment to our resolution on the sale, resale, and destruction of firearms that calls for our association and constituent associations to seek and support legislation and appropriations to research the causes and effects of gun violence. PTA is proud to support the Ask campaign and collaborate with Brady to help prevent gun-related incidents and keep children safe. It is now my pleasure to introduce Susan Poland, Deputy Executive Director of the American Public Health Association.
Hello. On an average day in the U.S., 93 people are killed with guns. For every person who is killed, 2 other people are injured. Of the 33,000 gun deaths each year, almost 2/3 are suicides. Basically, a person in the U.S. has roughly a 1 in 370 lifetime chance of dying due to gun violence, which is 1.5 times more likely than the odds of dying in a traffic crash. Initial hospitalizations for the treatment of gun injuries are approximately $735 million per year, but that doesn't include long-term treatment and care costs, lost wages, family costs, legal costs. This is an epidemic, and it's growing. We know public health has a critical role to play in addressing this problem, and every day we wait to take action is another day the epidemic continues to take its toll. The most important question now, what are we going to do to stop this epidemic? A comprehensive public health approach to ending the carnage requires a multi-sector approach and focuses on 3 simple steps. Use technology to make firearms safer. Use training and behavior changes to make us safer with our firearms. Make the environment safer by reducing the number of firearms and keeping them out of the wrong hands. So agencies, organizations, and individuals must work together to identify effective prevention and intervention strategies and programs, to improve policy in order to decrease gun violence, to identify persons at risk of perpetrating gun violence, and to inform the public of how to be safe given that guns are present in our communities. The fact that the federal government was limited in the research it can do by a few words added to the appropriations bills was a travesty, and the funding deficit should be reversed. For public health to be able to protect the public's health, we need to put in a few simple changes. We can make guns themselves safer by using smart technology, universal background checks for all gun purchases, strengthening domestic violence protections, and reinstating the federal ban on assault weapons and large capacity and ammunition magazines, and encourage safe gun ownership through gun license renewal, mandating safe storage, and putting into place programs that truly work to educate the public about gun safety, such as the ASK program. And as I stated earlier, we need to truly take a public health approach. We need to better understand the problem. We need a robust and funded research agenda to test simple solutions and develop new interventions to inform decision-making. But we don't use the solutions that we know already work to create policies that protect our children and our communities. Let's start there. We can and must do better. It is now my pleasure to introduce Dr. Michael Hirsch, board member and past president of the Injury-Free Coalition for Kids. Mike is also an executive council of the Committee on Injury, Violence, and Poison Prevention of the American Association of Pediatrics.
Thank you very much, and I'm really thrilled to have been asked to represent the Injury-Free Coalition and the efforts that we've done with the Brady Campaign to promote ASK in our 44 Level 1 trauma sites that are spread across all of the 10 American College of Surgeons trauma districts in the country. So we have been able to get many of the physicians in those institutions to advocate for the notion of asking. I wanted to just briefly mention that on November 2nd, 1981, my involvement with gun violence surpassed just my being a second-year resident at Columbia Presbyterian Hospital, where I was training in surgery. One of my best friends in the program was shot and killed right in front of the hospital, and that set off a chain of events that I think leads to a lot of, at least my part in this press conference. One is that our chairman of the Department of Surgery, to try to get a temperature and keep a lid on the unrest that this caused amongst the house staff at Columbia Presbyterian, which essentially got paralyzed after my friend John Wood was killed, asked for a special visitor to come and asked me to convene a meeting of the 500-odd house staff members in the Audubon Theater where Malcolm X had been assassinated just a few years before. When we went to that meeting, Sarah Brady came, and she was only 6 months out of her tragic gunshot wound experience with her husband, Jim. She had just started her efforts in trying to prevent handgun violence, and she had us all mesmerized as she tried to make the analogy that I'll try to make for you all, that Walter Reed, who is right here in Washington, D.C., the wonderful Army hospital that bears his name, was widely known as the person who conquered yellow fever in a time when there were no antimicrobials and really very few elegant medical techniques that he could use. But when he was in the Spanish-American War, he was able to figure out that the mosquito was the vector of the disease. And he treated that mosquito very rudely, made the poor soldiers wear long pants and long shirts and have mosquito netting and draining a lot of the stagnant water around camps. He conquered yellow fever, which was killing more of our troops than the actual Cuban bullets were. So she said, treat the gun like the mosquito. We can't always figure out how to get to these higher levels of why we want to hurt each other, why we want to hurt ourselves. But the lethal means access reduction principle, she hit on it in 1981. And now look what she has spawned, this wonderful Brady organization that has spread that mantra, and the ASK campaign is really part of that. Injury-Free has embraced it. I've embraced it. I have additionally had a program called the Goods for Guns Buyback Program that if a patient that I ask tells me I have a gun and I want to get rid of it, how do I get rid of it? It's not a legal gun. I've been buying them back with some nominal gift cards from local grocery stores. And this year, in Senator Markey's state of Massachusetts, where I work as a trauma surgeon at the local medical school in UMass, we are going to be doing a 6-state gun buyback in New England on the approximate 5th anniversary of Newtown. A lot of this has been a tribute to Dr. Barbara Barlow, the founder of the Injury-Free Coalition, who has developed an approach to injury where I was able to plug in gun violence, and I was able to come up with one solution that I think has really reduced the penetrating trauma rate in central Massachusetts where I work. So I want to also say that the work of Brady and the work of Dr. Barlow and the work of many of my colleagues in the Injury-Free Network has led to many of the medical schools in the institutions where injury-free sites are to try to introduce into their curriculum education for medical students, because the young doctors coming up are going to be asking. They're not going to be ignoring this. That's why we have a medical student here to just illustrate that the long white coat is going to teach the short white coat, and the short white coat is going to change the world. So I thank you all for the opportunity of supporting this wonderful GAO validation, because I think that doctors have the obligation to use their bully pulpit to ask patients and ask families to ask their kin, are you okay with having your gun? You're having a rough time, you just went through a divorce, you're unemployed. Maybe it's a time to get your weapon out of the home or store it safely, and we can help you with that. So just this past year on February 16th, the 11th Circuit Court of Appeals struck down by a 10-to-1 vote with the help of Brady Campaign footing a lot of the legal fees, a gag law in Florida that prohibited docs from asking about this kind of information. And we have to celebrate that victory and drive a truck through this little gap so that all docs participate in this ASK program. So I hope we can move this forward now with the GAO's help. Thank you very much.
Thank you, Mike, and Susan and Jim for the work that all of you are doing. Obviously, at Brady, what we're doing wouldn't have the reach or the scope or the impact without the support of the Injury-Free Coalition for Kids, APHA, and the National PTA. So thank you very much for participating today and coming, and I'll open it up for questions if anyone has any. Yes?
Thank you. Andrew Simmons with CQ. You mentioned the need for robust investment into gun research. Do you have any idea how much you think should be earmarked for that amount? And can you give any examples of research that you think could be conducted or prioritized right away?
Well, when the Dickey Amendment was first passed, and I think Senator Markey was quite eloquent about the fact that later in life, Representative Dickey actually regretted zeroing out the funding. The funding allocated was $100 million. That's a good place to start and may catch up for the deficit that we've had for a very long time. I think the GAO report outlines key and critical areas where additional research would help. This is a review that GAO has done on gun safety programs. That's not research necessarily into all of the causes of gun violence in our communities, where significant additional research could actually make a big difference to determine what programs should actually be funded going forward. And I will say, and then I'll turn it over to the real professionals here on the public health side, it's not just the lack of federal research. We all know that federal research leads the way to additional research dollars. So it magnifies the amount of investment that can be made. So we're losing all the way around based on this notion in Congress that no research can be done. In fact, NIH just zeroed out funding for one of the few remaining research areas into gun violence prevention in the last year. So we need more of it. And I'll turn it over.
I have a question about the Dickey Amendment. Do you think that the Dickey Amendment needs to be repealed, or do you think that there's a way forward if it stays in place?
I certainly think there is a way forward if it stays in place. If you read the GAO report, what it's had is effectively a chilling effect. So I think Congress can do all of the great federal workers who do so much incredible work for us a lot of good by actually earmarking specific funds for these purposes. But from a practical standpoint, could they go ahead with it? Certainly from our perspective, Brady's is yes, they could. Any other questions? Thank you all for coming today.
Very nice to meet you. Yeah, I hope you can meet your daughter proud today.